Assalamu everyone, welcome back to the Global Mind Voyage. I hope all of you are doing well. Today we are starting a brand new playlist called Therapies in Psychology. In this playlist, we'll learn about the major psychological therapies used by psychologists around the world. Whether you are a BS student, an MA or MPhil student preparing for the competitive exam, or simply interested in mental health, this series is designed for you. We will begin with the most fundamental questions like what exactly is psychotherapy? Is psychotherapy the same as counseling? Who needs the psychotherapy and how does it actually work with the people? By the end of today's lecture, you will have clear answers to all of these questions. So let's begin. Let me ask you a few questions. Have you ever heard someone say therapy is only for crazy people? Or perhaps, why should I pay a therapist when I can simply talk to my best friend? These are very common beliefs, but are they actually true? Imagine someone has diabetes, they visit a physician without any hesitation. Someone with a broken bone immediately goes to an orthopedic surgeon. But when people experience depression, anxiety, panic attacks, trauma, grief, or overwhelming stress, many hesitate to seek professional psychological help. Why? Mostly because of the myths, stigmas, and lack of awareness. Today's lecture will help us understand, separate facts from the misconceptions. Before understanding different therapies such as CBT, psychoanalysis, humanistic therapy, ACT, or DBT, we first need to understand psychotherapy itself. Think of a psychotherapy as an umbrella. Understand this umbrella. Many different therapeutic approaches exist. Throughout this series, we'll study each therapy individually. But without understanding psychotherapy first, it becomes difficult to appreciate how these approaches work. Psychotherapy is not just about treating disorders, it is also about improving emotional health, solving problems, building resilience, and helping people live more meaningful lives. Let's understand the word itself. The term psychotherapy comes from two Greek words. Psyche refers to the mind or soul. Therapia means healing or treatment. Therefore, psychotherapy literally means healing the mind through psychological methods rather than through medication alone. It is important to note that psychotherapy is evidence based. It is not simply giving advice or having a casual conversation. It uses scientifically developed techniques to help individuals improve their emotional and psychological well-beings. This is the definition I want you to remember. There are four important ideas in this definition. First, psychotherapy is professional. It is conducted by trained mental health professionals. Second, it is evidence-based, meaning the techniques are supported by scientific research. Third, psychotherapy uses psychological methods, not magic, superstitions, or casual advice. Finally, its goal is to help people understand and manage emotional behavior and psychological problems while promoting healthier coping strategies. Remember, psychotherapy is a collaborating process. The therapist does not fix the client, instead, therapist and client work together toward meaningful change. Before moving to the next part of our lecture, I would like you to reflect on these questions. Think about your own experiences or what you have observed around you. Why do many people feel comfortable visiting a doctor for physical illness but hesitate to seek help for emotional struggles? Have you heard common myths such as therapy is only for crazy people? Talking to a friend is enough. Therapy means you are weak. Keep these ideas in the mind. In the next part of the lecture, we'll examine these myths using psychological evidence and discuss who can benefit from the psychotherapy. Now that we understand what the psychotherapy is, the next important question is, what are its goals? The primary goal of psychotherapy is not simply to remove the symptoms. Instead, it's aimed to help people build healthier ways of thinking, feeling, and behavior. The first goal is reducing emotional distress. Individuals struggling with the anxiety, depression, grief, trauma, or stress can learn healthier ways to manage these emotions. Second goal is improving coping skills. Life is full of challenges: academic pressure, work stress, family conflicts, financial problems, and unexpected crises. Therapy teaches practical coping strategies instead of unhealthy responses. Another important goal is changing unhelpful thoughts and behaviors. Many psychological difficulties are maintained by negative thinking patterns or maladaptive behaviors. Therapies like CBT help individuals identify and modify these patterns. Psychotherapy also focuses on improving relationships. Better communication, emotional regulation, empathy, and conflict resolution often lead to healthier personal and professional relationships. Finally, psychotherapy supports personal growth, helping individuals understand themselves better, clarify their values, and live more meaningful lives. A common misconception is that psychotherapy is only for people with severe mental illness, but in reality, psychotherapy can benefit almost anyone facing emotional, behavioral, or interpersonal challenges. For example, individuals with anxiety disorder can learn techniques to reduce excessive worry. Those experiencing depression may develop healthier thinking patterns and regain motivation. Therapy is also effective for conditions such as obsessive compulsive disorder, post traumatic stress disorder, eating disorders, and many other mental health concerns. Beyond mental health disorders, psychotherapy can help people dealing with the relationship, conflicts, grief after losing a loved ones, workplace stress, anxiety, exam anxiety, or low self-esteem. Even individuals without a diagnosis, mental illness may seek therapy for personal growth, decision making, emotional awareness, or improving communication skills. Seeking therapy is not a sign of weakness, it is often a proactive step toward better mental health. Students often ask whether counseling and psychotherapy are the same. The answer is they are closely related, but not always identical. Counseling generally focuses on specific life challenges such as career decisions, academic stress, relationship issues, or adjustment problems. It is often shorter in duration and solution focused. Psychotherapy may also address current concerns, but it can extend further by exploring long standing emotional patterns, personality, trauma, or recurring psychological difficulties. In practice, however, these terms often overlap depending on the therapist's training, professional setting, and the client's need. Therefore, while the distinction is useful academically, real world practice may not always separate them clearly. Let's address some of the most common myths surrounding psychotherapy. Like myth 1, therapy is only for the people with severe mental illness, but in fact, people seek therapy for many reasons, including stress management, grief, relationship issues, and personal growth. Myth 2, therapy is simply giving advice, but in fact, professional therapists use evidence based psychological techniques rather than personal opinions or casual advices. Myth 3, therapy produces immediate results, but in fact, meaningful psychological change usually takes time, patience, and collaboration between the therapist and the client. Myth 4, talking to a friend is the same as the therapy. Friends provide valuable emotional support, but trained therapists apply scientifically validated intervention within ethical and professional guidelines. It is also important to understand the different professionals involved in mental health care. A clinical psychologist assesses diagnosis and provides psychotherapy, psychotherapy for a wide range of psychological disorders. A counseling psychologist often works with adjustment issues, relationships, stress, and personal development, though their scope can vary. A psychiatrist is a medical doctor who can diagnose mental disorders, prescribe medication, and may also provide psychotherapy depending on the training. A psychotherapist is a trained professional who can practice one or more forms of psychotherapy. Depending on the country, this title may have different legal and education requirements. Psychiatrist, social worker, help individuals and family assess mental health resources, provide psychosocial support, and work closely with the multidisciplinary teams. Before we enter this lecture, let's review the most important points. Psychotherapy is a scientific and evidence approach that helps individuals improve emotional, behavioral, and psychological well being. It is useful not only for treating mental health disorders but also for personal development, stress management, and improving relationships. While counseling and psychotherapy share similarities, they may differ in depth, duration, and focus. Most importantly, seeking psychological help is a sign of awareness and strength, not weakness. Just as we care for our physical health, we should also care for our mental health. Imagine a university student experiencing panic attacks before exams. In future lectures, we'll see how therapies like CBT help such students identify unhelpful thoughts, reduce anxiety, and gradually regain confidence. Today's lecture introduces the foundations of psychotherapy, what it is, why it matters, who can benefit from it, and how it differs from counseling. In our next lecture, we'll explore the major schools of psychology, including psychodynamic, behavioral, cognitive, humanistic, existential, and integrative approaches. Understanding these schools will make it much more easier to learn therapies like CBT, DBT, psychoanalysis, and ACT later in this series. If you found this lecture helpful, don't forget to like, subscribe, and share it with your classmates and fellow psychology students. Thank you for watching the Global Mind Voyage. I will see you in the next lecture.